Greetings and salutations, I'm Dexter from Research Stripped, and in this episode we'll be discussing a study from 2002 in which the researchers tested a hypothesis that the components of semen, not sailors, may have antidepressant effects on a woman after unprotected vaginal intercourse. They did fail to test other routes of administration of semen. Maybe they'll try that in a future study. Let's begin with some background into the biology, metabolism, and how absorption works in the human body. Most common is absorption through the oral route, taking a pill or eating a snack or meal. But there are a variety of ways that chemicals can be absorbed into the body. For example, through the skin, such as nicotine patches. Inhalation, think cigarettes or wacky tobacco. Next, you have buccal. Chewing tobacco is a good example of that one. People are rather inventive when it comes to getting nicotine into our systems. Moving on, sublingual, legal drugs. If you've ever seen a movie or show that a man clutches his chest, usually when he's stressed out, opens up a bottle of pills and takes one, then feels a lot better immediately afterwards, he's taking nitroglycerin tablets that are absorbed sublingually or under the tongue. Next is up nasally. Then you have rectal, and finally vaginal. For completeness sake, there are other routes: subdermal, intramuscular, intravenous, and so on. But what does this have to do with semen? Don't worry about that, I'm coming to it. When you take something by mouth, it gets broken down in your GI tract, the stomach and small intestines mostly. From there, it gets processed by the liver almost immediately. Take alcohol, for example. Drinking on an empty stomach increases the amount of alcohol absorbed because it doesn't stick around in the stomach long enough for the stomach to break it down with some specific enzymes. Drinking on a full stomach allows the stomach to break down more of the alcohol, since not only is the alcohol being absorbed, but also the nutrients from the food. Stomach can only absorb so much stuff at one time. That allows the enzymes to break down the alcohol further. Most of the blood from the stomach and small intestines flows directly to the liver to be broken down further before the alcohol is available to the rest of the body and brain, giving you that nice buzz feeling, or just the excuse to be an asshole or a sloot. This is coined first pass metabolism. It must first pass through the liver before going anywhere else. Next comes the fun part. If the alcohol is absorbed from your bum, there are no enzymes, nor does it pass through the liver before entering the bloodstream, giving you more bang for the buck from your bum, so to say. This way of getting drunk is called getting alcohol enema, or for the more uncouth, butt chugging. I highly recommend not doing this since it could lead to rapid alcohol poisoning, damage to the inside of the bum, leading to severe pain and bleeding, or even killing off the inside, which in the best case gives you colostomy, or worst case, it kills you, particularly if wine is involved for some reason. Maybe it's due to its acidity. Just for your information, the colostomy is used when you can no longer poop from your butt. Instead, the surgeon creates an artificial hole in your abdomen where you poop from, and a bag is placed over it to collect it. It does tend to fill with gas and needs to be burped occasionally. Otherwise, the bag might pop off, leaving a mess. Alright, you're probably thinking that this is very uninteresting, Dexter, but what does this have to do with man juice creating happiness? Don't worry about that, I'm getting there. The inside of the vagina has about the same absorption properties as the inside of the butt, meaning chemicals are directly sent into the circulatory system without going by the liver. But the absorbability changes a bit with the menstrual cycle. Usually within 2 hours post-semen administration into the vagina, various seminal chemicals can be detected in the woman's bloodstream. For instance, testosterone has approximately a 60% absorption rate after unprotected sex. All this is known by lab tests, but do these additional chemicals in the woman's system have any behavioral effects? Gallup et al. Decided to test this back in 2002 when they, and I quote, measured depressive systems in college females as a function of sexual activity and condom use. Consistency of condom use was used as an index to the presence of semen in the female reproductive tract. The researchers used 293 female college students, obtained their sexual history, including condom use, and had them complete a psychometric test to measure their depression level. Women who never used condoms scored lower on the test, meaning that they were less depressed. They also had more sex than the others. The researchers also wanted to see if being in a relationship had any effect on the depression score, with those being in a relationship being slightly less depressed, but was determined not to be significant enough to say for certain if there was any correlation. They also found that the length of a relationship was inversely proportional to the frequency of sex, or the longer that they were together, the less frequent tab A was inserted into slot B. One of the questions that the researchers asked is if the students ever attempted suicide. Now, here it gets a bit interesting. 4.5% of the never used condoms group admitted to attempting, 7.4% of the sometimes used condoms group, and 28.9% of the usually used condom groups attempted. And finally, the 13.2% in the always group. They also found that the women who never or sometimes use condoms tend to be more depressed the longer it had been since they had sex, possibly using sex to relieve depressive feelings. The authors state that all this is just preliminary reporting, and if correlation is to be proven, then more intensive and expensive research must be done, including the blood tests. They also mention that there are other factors that might be at play, including the use of oral contraceptives, or that the women who never used condoms were having more sex more often, leading them to be less depressed. So it could be that sex and not the semen worked as the antidepressant. 12 years after the researchers published Does Semen Have Antidepressant Properties? Another researcher published an article that disputes the results. Pavel Prokop, hopefully that's right, replicated the study in Slovakia with heterosexual women ages 18 to 70. In addition to the psychometric tests for depression, he also rated the women's partner's satisfaction. Prokop found no correlation between condom use and depression, as the side-by-side comparison shows. This gentleman also took into account other ways of administering semen, orally and anally. Way to be complete there, my man. Overall, he also found that suicide attempts were rare, 7.2% of the entire group, and the results were not significant. It may be that American college women are more than willing to attempt to exit their bodysuit, whereas Slovakians are rather fond of theirs. This more recent research, in summary, showed no correlation between semen encounters and depression. And, from an evolutionary standpoint, why would semen have these properties? Caveman wouldn't care if his mate was happy or not, as long as she popped out his little cave people. I do have an issue with Prokop changing the age range to include postmenopausal women, which, as mentioned earlier, menstrual cycles affect the absorption inside the vagina. I am sure the menopause would probably also have the same absorption changes, if not more so. So, what do I think of this? I would have to say that vaginal administration of semen for antidepressant effects might be akin to using valerian root for anxiety or echinacea for immune support. But this is all up to you to decide, and enjoy yourselves. Or don't. And now for a bonus. Semen causing allergic reactions. This can range from mild irritation to apparent anaphylactic shock symptoms. This reaction is called Seminal plasma hypersensitivity, or SPH. And there seems to be two types. The first is the poor women that have this reaction with any semen that they encounter, and it may be similar to other people with allergies such as peanuts or insect stings. But more common is the woman who has SPH to a specific man's semen. It is theorized that, and I quote, may be a consequence of evolved mechanisms that function to discourage mating with a man whose genetic makeup does not represent a good fit for that particular woman. Women who have SPH with a particular man will find it difficult to conceive. Not only does the irritation and pain make sex a less likely occurrence, but there is also a high risk of first trimester spontaneous abortions or miscarriages, or early infant deaths. There are treatments. The gold standard is to use condoms during intercourse, but if the woman wants to conceive, she might attempt desensitization with an allergist, but those have mixed results. And I wonder how the allergist obtains the allergen. Does the woman's partner come in and provide a sample? And if so, how much and how often? And with that, goodbye.